Good afternoon. Thank you very much. We are going to jump right in with today's live stream. We're discussing some of what's happening around districts on Long Island and actually throughout New York State, where at this point in the school year, districts are being asked to do some COVID testing in their schools. When you think back to last March when we left, and then this year when we began, and people talked about all the different things we had to do in schools, and we just kept shaking, I at least kept shaking my head like, I don't know how we're doing this. I don't know how we're doing this. And yet somehow people came together, the community came together, and we were able to pull this off. And here we are looking at the new year and the holiday break and still together in our schools with our kids. It's really, I think, amazing undertaking, and speaks volumes to what's happening in the Sachem school community and with the Sachem family. So yet another challenge for us, COVID testing in buildings, in schools. If we were to be declared a yellow zone, orange zone, or red zone based on several different metrics around hospital use, emergency use, ICU use, and testing positivity rates in different districts. And so Sachem is looking at that information. We have been requested to do a willingness to test survey. We have over 3,000 responses at that point now. We've also asked our staff to work with us on the willingness to test survey. Those protocols are happening and coming into play, and we're very close to having reached, been able to reach 20% of our students in terms of the testing. So that's a good thing if, in fact, we did have to test our students. I know there were a great many questions that people had around testing and testing concerns. And so we did visit a nearby district. I asked Mrs. Trombetta, who's here on my right, and Mrs. Hines, who's here on my left, to visit the nearby district and see their testing. And ladies, you're going to walk us through some of what you saw, I believe. Patty, you want to go first?
Sure. So it was very organized. Students that had given consent to test when they did the willingness to test survey were then sent actual consent form that parents filled out or staff filled out. They came with that consent form. So when they first
Patty, I'm going to cut you off each time, which is inappropriate and unprofessional. I apologize, but things just pop in my head sometimes, so I have to jump on it. So when I filled out the survey now, if I'm a parent that filled out the survey, and we have over 1,000 that have said yes, so they didn't do a consent yet. Nope. They didn't get the consent yet. That was us finding out who wants to do it, yes, who will do it.
So if we
and then they would, 20%,
right? Then those parents that said yes to testing will get emailed a consent form that they will fill out.
Okay, so they don't have it yet, so they shouldn't panic like, where's my consent form?
Right. No
we
one
didn't
has
send
received
anything out yet. Okay, good.
So when you arrive at the location, the first thing you do is sign in and your temperature is taken. And you fill out basically just like the health survey that you get every morning. You know, do you have any symptoms, anything like that? The second step is to show the confirmed consent form. If you are an adult, if you're 18 years or older, you can fill it out yourself. If you're a staff member, you can fill it out yourself. But a student must have that present with them in order for them to go to the next step. The next step is you walk in. They did it in the gymnasium, a back gymnasium. There's seats socially distanced 6 feet apart. The students waited there, the staff waited there. When they were called, they were brought up to a nurse's station. And at that point, the test was given. It was a gentle nose swab. It was not up the nasal cavity. As soon as they were done with that test, that student or staff moved to the other side of the gym and they waited for their test results. That nasal swab sat for 15 minutes. And that's when the results were given to the next nurse. And the nurse took that and then read the results, logged the results once there. Those results were given to basically an education table where that patient, student, or staff was called up. The results were shared with them. If they were positive, they went into an isolation room immediately, taken there by a staff member. If they were negative, they were sent back with their paper to class. And after that, the results were logged in a second time to make sure for accuracy. Every single person that was tested that day was logged into the system. Once when they had to confirm the consent and check all the information, and then with the test results as well.
So let me ask you a couple questions,
Sure.
Patty. I'm an 11-year-old kid. Am I going to be told whether I'm positive or negative?
If you are 11 years old, you're a middle school, secondary student, yes, you'd be told.
Okay. I am a 7-year-old child, 6-year-old child. How am I getting tested? Are my mom and dad or whoever going to be there? And will they be told, or do I get told and sent off to a room or something?
The way that Ms. Hines and I imagine it to be, any elementary student will be coming with their parents. They will wait together. We'll have, instead of single seats, we'll do it like we did for graduation, groups of 3. We'd have groups of 2. So you'd sit with your parent while you're waiting to get tested. When you're tested, the parent can be there as well, standing with the nurse. And then they'd go to the other side where they waited for the results, again, in 2s. And then when they were called up to the education table, the student would learn with the parent.
Okay. So again, we're not going to just have 6-year-olds find out you're positive. Get out of here, kid. You know, like we're going to be really careful with this. But so elementary kids will have parents, but not secondary. The seniors are not going to have their parents with them.
No. Any secondary student we feel can be tested by themselves as long as they have the confirmed consent from their parents to do so. And then all elementary plan to have morning hours and afternoon hours for them to come with their parents.
Now, there are all privacy pieces here, so we have to be very careful about if a child is positive, what happens, that's those steps, parent call, isolation room.
Yep, 100% all HIPAA laws will be followed.
Okay, excellent, excellent. Speaking of gentle nose swab, Mrs. Hines, I turned to you because I looked in the FAQ we sent out the other day, and there was actually a video of you taking the test, which I commend you for. I thank you. I don't even know if you were supposed to be doing that there, but let's not get into that.
Well, Ms. Trombetta and I felt it was really important that the HM families saw that it wasn't evasive. It was very quick, very gentle, and we were happy to make the video for our community.
Some folks have had the experience where they take that thing all the way up to like your brain stem. This is not anything like that.
No, not at all.
I saw it in the video.
That's
very
the
gentle.
PCR test, the one that goes up the nasal cavity.
Okay.
Yeah, as Ms. Trombetta said, it was a very organized process that we feel like we can also implement here. I think it's just important to note, and I know Dr. Pilateri said this in the beginning, we are not near, needing for us to test at this time, but we like to be proactive and make sure that we're all set up for everything. And this FAQ should be able to walk you through some of the questions you might have on top of the process that Ms. Trombetta just talked about. So you've probably heard in the news about Governor Cuomo's micro-cluster initiative, and you may have heard of some areas, Hampton Bays, Riverhead. These are school districts who either preemptively or had to started doing some of this COVID testing, and we did visit a neighboring district ourselves, as you know. So the microcluster initiative does go into 3 different categories: yellow, orange, and red. And again, we are not at this level, but perhaps Dr. Pilateri will let us know a little bit later on if we do get close, how the Department of Health does contact school districts. So if we are in the yellow, our student population is about 14,126 students. In yellow, we would have to do 20% of our in-person students, faculty, and staff. So all 3 of those groups, we would ask that anybody willing to test, that would be very helpful for us. But that is approximately, right now in district, we have about 12,700 staff members, that students and staff that are present. The rest are on remote, as you know. And so that would be about 2,500 students. If we were to go to orange, it's now going to be about, if we go into the red zone, I'm sorry, it's about 3,800 students and staff. And is it only students who are tested? No, as we just said before, we do, or we would be looking to test both staff and students.
Oh, Erin, we probably would have to get to the 20% number.
Yep.
If I only get 10% of the kids saying yes, would we test the same 10% twice over the 2 weeks?
No.
Okay, good. Yeah, that's a concern that some parents have, that, oh, you're only getting half the kids, so you're going to test my child twice. And that is not the case. We will not test anyone twice during this testing.
Right. And that's why it's so important that if you have not filled out the willingness to test survey, which is on the FAQ that we've provided, following this live stream and after reading through it yourself, you may want to log on and help us out. But I think you said earlier, right, that we have pretty good numbers right now
close.
in terms of
we're
20%.
Not fully there, but
right.
We're getting, so we could use more folks who are willing to test and to do the survey. And I'm holding a printed copy of what we sent home the other day. Is this also on the website anywhere? Do you know?
Yes, we actually have just it is on the website right now, but we are trying to make it a little bit more of a highlight on our district website. So you should probably see by tomorrow, there's some information about distance learning, but then there's also some information about COVID testing. There is a tab, but this FAQ is highlighted on the front page of our website right now. We're just trying to make it a little bit bigger so that folks definitely know where to navigate and go for it.
Let me ask you another question. Will my child come home one day next week or 2 weeks from now and say, hey, they tested me for COVID today?
No, absolutely not. Again, once we near that time, I think Ms. Trombetta had said that anybody that did fill out a willingness to test survey would then be getting the paperwork needed for the parent to then give consent for their students, so they would know ahead of time. And again, if you're in elementary, you'd be coming with your child.
Thank you.
Is your child required to be tested? No, absolutely not. Again, this is, based on if you feel safe. Of course, though, we would encourage. My apologies. Of course, we would encourage.
Your famous people are calling you because you're on the live stream now to tell you
I think
you're
they
on
watched
the
the
live
video.
stream. Yeah.
I think they watched the video. Oscar worthy. If I'm sorry, I forgot where we were for a second here. No, your child does not need to be required to be tested. It is important, though, as we had said, that there are long lines everywhere for folks to be tested. And so this is an opportunity for both our students and our staff to just make sure that they are safe, and any family members or any friends that they are around, that they can feel that they're safe around them as well. So we do feel like this is a healthy opportunity for anyone looking to proactively test.
So I'll jump in, and you've heard me say, well, maybe not heard me say, but I've written it in emails that I think the PCR test is more accurate.
Yes.
And if you're waiting results for PCR test because you had symptoms or direct contact, you should wait for those results to come in, as opposed to a rapid test, which is not as great a test, it seems, in terms of the data. So people are saying to me, you're telling me one thing, Pelletier, but now you turn around and only giving rapid tests.
Right.
Why aren't you doing the PCR test? And again, we don't have a choice in this. We don't get to decide which test
Right.
it is. The rapid test is a much, I think, far lesser expensive test. And so we get the test for free. We don't have to spend anything on them. And these are the tests that are offered to us. And so these are the tests we're giving. They are the rapid tests, even though, yes, you've heard me say or write that the PCR tests do seem to be more accurate. This is what we have to work with. So this is what we will work with.
Yes, absolutely. And the Department of Health is really a partner with us. The school district that we went to, the Department of Health was actually administering all of the assessments or all of the tests for us. And considering our size, we would hope that we would get that same support. However, first layer is the Department of Health staff would be the ones to administer the test. And then following that, Ms. Trombetta, we had talked about, then it would be our own nursing staff and or other trained and qualified staff that we have here in district.
Yeah, we certainly would rely on and look to rely on Department of Health folks first and foremost.
Right.
And as we saw this other district was able to, we would look to do the same.
Results of the test, because it is rapid, and as it was said before, will be known in about 15 minutes. Everything is logged onto the Department of Health portal, whether you're positive or negative. Can you accompany your child? Again, we have said that for all elementary students, we would ask that a parent come with them. And then for the secondary students, we do feel that they would be independent in being able to do that throughout the school day as we have it set up. If there's any unanswered questions, I guess you can ask any of us.
Yeah, and any of us can, your school principals may have some more information. If you have questions, certainly feel free to reach out to the three of us as well. I guess the concern would be is where would it actually take place? Now, when you visited, they had one high school where they were doing it, and the entire district was able to go there and do that. Again, 12,000, 14,000 kids, 15 buildings. I don't know if we'll be able to nail it down to just one place or 2 sites or 3 sites, but we will work through those pieces. And also there are other ideas in this in terms of we have so many zip codes involved in our district that they may say, hey, this district, these 5 schools are in a yellow zone, but these other 10 are not. And therefore, that might impact some of our decision making, would impact our percentages in terms of how many people said yes or are willing to test, could impact a lot of things. So that's why we haven't finalized some of those pieces yet. But the idea would be that, especially with elementary kids, parents could come and we would try to do it later in the day after pickup, that type of thing. Again, a lot of it is a juggling act, but I know that we'll get it right once we move toward that.
Yes, absolutely.
Okay. I think we're good. Any questions from the audience? Well, there is no audience. So if you have questions, please feel free to reach out. I just want to take this moment to thank you for your hard work, your communication, your cooperation, your working with us. It's what's making this entire plan work. So please stay safe, stay socially distanced, fill out your daily health surveys. Let's keep working together, keep our kids safe, our staff safe, our community safe. And I really hope for you a healthy, happy, safe holiday season, and 2021 cannot get here soon enough. So looking forward to that. Be well. Thank you.
Thank you.
Thank you.